Good evening, friends. I hope that you are being safe and not having a large gathering in your house. This is Dr. Dena Grayson, of course. I know it's been a little while since I've done a video, so I thought I would just pop on here to, first of all, say hello and ask you how you're doing. I think that all of us have pandemic fatigue. I mean, this COVID fatigue is really, really hard. And I was just speaking with some friends over the phone, and they were talking about how, they have all these traditions at Thanksgiving. They love having their family over and the types of things they like to cook. And we were just talking about having to do that virtually, which, you know, it's hard for everyone. But friends, it is so important right now. As you know, those of you that follow me on Twitter, you see I just posted a couple out about an hour ago the case counts. We just surpassed 11 million cases of coronavirus in this country, only 6 days after we passed 10 million. So the number of new cases are just accelerating in this country, and we are entering, unfortunately, and I wish the news were great on this front, but it's not. We're entering an extremely dark period of time in this pandemic. I think we know why that is, and a big reason is, the outgoing Mr. Trump. And fortunately, the good news here is that he will be out come January 20th. The bad news is that he's still going to be in office for another 2+ months. And already we're seeing record after record being set day after day after day. We have hospitals that are already overwhelmed in El Paso, Texas, for example, where there's 10 mobile morgues and they've had to bring in inmates to actually carry out the dead. I mean, this is really harkening back to the dark ages. I mean, it's really that bad in El Paso. The Dakotas are just aflame with infections. The hospitals are getting overwhelmed. In fact, in North Dakota, the governor told the nurses, even if they test positive, they need to go back to work. Now they're working in COVID wards, but still, this is how bad it is that people testing positive, essential healthcare workers, they can't stay home because then the hospitals and the healthcare system will just collapse. So my friends, I'm really urging you. We are entering this very dark period, and we know that in-home gatherings are really fueling the spread of this virus. And I want to get together with my loved ones for Thanksgiving like crazy, as I was just mentioning earlier in this broadcast. I know you do too, but do it virtually. Do it via Zoom, whatever app you like to use, FaceTime. I don't care, but please be virtual. What I don't want is you get together with grandma for Thanksgiving and then you're burying her at Christmas or Hanukkah or whatever you celebrate later this year.
Are you suggesting for those making plans right now for the holidays to scrap the plans altogether to go visit family?
Absolutely. It is not, if you love your relatives, don't get together. Okay. Because you can do all the testing you want. Look at what happened at the White House. They test people every day that come in, and the White House is a coronavirus hot zone. You could test negative this morning and not have a high enough viral load to test positive. But then by the evening, when you're together with your family, you could be shedding virus and infecting your loved ones. So again, I just urge people, if you do want to get together, be outside, be physically and socially distant. You want good ventilation and wear masks. So maybe don't have that Thanksgiving dinner together, but maybe drop off Thanksgiving dinner for grandma. You could sit in the garage or the driveway, have some distance from her, make sure she's wearing a mask, make sure you're wearing a mask. But I want to hug my older relatives.
Right.
I want to be with them for Thanksgiving as much as anyone else, but it is really, really dangerous. And I can't emphasize that enough. Please, we've got this huge acceleration of cases already in Canada. In mid-October, when they celebrated their Thanksgiving, right after that, they had a big explosion of cases in Canada, and their leadership is warning, look, we can't do this at Christmas, because we do this at Christmas, our healthcare system will collapse. Well, we're way, 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 way more cases than Canada, and that's where we're at. So that's the bad news. Now, here is some good news, of course, on the vaccine front, my friends, and I have posted about this. I have put out some videos about this, but the very encouraging news is that the early data from Pfizer's vaccine trial look extremely, and I say extremely promising, 90% effective, much higher than we expected for these first generation vaccines. We thought it might be a 60, 70%. That was coming from Dr. Fauci himself, who kind of is under the hood. He sees a lot more of the data than I do in real time. So that's really encouraging news, not only for Pfizer's vaccine, but likely Moderna's vaccine, which works very similarly to Pfizer's vaccine. So I think that's the good news. Now, the not so good news, of course, is the timing. Even though the government has ramped up, not the government, but just has bankrolled the ramping up of production of many of these vaccines, including Moderna's, and Pfizer themselves have ramped up production. Pfizer said that they only have about 10 or 20 million, enough doses to vaccinate about 10 to 20 million people by the end of the year, to actually have those doses available. But that doesn't mean people are vaccinated right away. It has to be distributed. It takes 2 shots, at least with some of these vaccines. So we're really looking at, unfortunately, my friends, months and months and months. And that's in the middle of pandemic fatigue. So I'm with you. That's why I'm telling you, I love you. I'm trying to be here for you. I think we all have to try to be here for one another virtually, because if we do get together, my friends, even though you think your friends are being safe, you think your family's being safe, your loved ones are being safe, all it takes is one person. And we've just seen story after story after story, people getting together, 6 people, 10 people for just, oh, it's just our friends, or it's just our family. We're safe. We got tested. Well, I mean, we know what happens even with when you do testing. Look at the White House. It's a massive coronavirus hot zone. They've had 3 waves of infection in the White House, and they test everybody every day, and they've got rapid turnaround tests. So just because you tested negative this morning, tonight you could be shedding virus and be positive.
What do you have to say to the people who still believe that the coronavirus pandemic is a hoax, who still don't believe that vaccines are effective? What do you have to say to them?
I think that they need to, listen to the stories of people who have been infected, listen to them and these just heartbreaking messages that they're sending to their family over the phone, over video, as they're dying, sort of last interactions with their families. I mean, these are very real stories. This virus doesn't care what political party you're in, and it doesn't even care if you think it's a hoax or not. It will infect you, and it can kill you. So, I think that unfortunately, this really is at the feet of Mr. Trump. He has been pushing this nonsense from the get-go because he knew that having a viral pandemic probably was not very good for his reelection chances. He chose to ignore it. And unfortunately, again, we've got 250,000 Americans, and now they're grieving families that really tell the true story.
Right. It's important to remember these are real people behind all these numbers.
So please, my friends, please stay strong. Please stay vigilant, especially around your relatives who are vulnerable and could really have high risk for getting sick or dying from this virus. I love you. I'm sending you a big hug. I'm wishing you in advance happy holidays. And in fact, through the holidays, I will get my butt out here on the video to just be there with you. I promise you I will. Please leave your questions. Let me know what else you want to hear about this week. I'll try to post some more videos coming up. I love you, my friends. Wear your mask, avoid gathering, stay home as much as possible, and please be safe. Much love to you.